אז זה דוקטור רוברטו דל'אבנזאטו ודוקטור פרנצ'סקו מרגוני מחברת אופטון איטליה, והם בעצם יראו לנו היום גם הדגמות וגם יעשו הרצאה קצרה על הנושא. אז ברוכים הבאים ונתחיל.
Thanks for inviting us. I represent Eufoton. We manufacture diode lasers since 20 years in Italy. Not only diode lasers, but optical fibers connected to diode laser. That is the main focus of our technology we are going to show you today. Once it will be the moment to speak about the technology, I will take the word from Roberto for 1 minute and I will explain you in detail how the fibers are made. Thank you.
Thanks again for coming, for sure. I'm Dr. Roberto Dell'Avanzato, as you can see, from Italy. I'm happy that you are, all of you, plastic surgeon. It's my best target to talk. So the first step, the important step, is in 2006, when the FDA approved the laser lipolysis as the best and the most effective procedure to destroy the fat. This is the main things that they said. The question was if the addition of laser could spur tightening of the skin. So the main thing is when we destroy the fat, we just create an empty area and the skin maybe can falling. Maybe we can destroy the septum so the skin can falling. With the cannula, with the Mercedes cannula, 3-4 millimeter, we can destroy also the vessels, so it could be risky for the life of patient. You know, some patient died, some patient have thromboembolia, some patient can have problems with the old technique, with the liposuction. So the researcher looked at the event of skin tightening in nearly 2,200 women and men who received the laser liposuction in various body regions. So they do a very strong work to understand how the laser liposuction can improve all the liposuction in terms of obtaining good results. So this is what the study leader author said at the end of the treatment. So the amount of skin tightening with laser liposuction is probably about 50% better than what will be achieved with traditional liposuction. So to do the liposuction with laser could be just better for the result that we can obtain in order for the tightening of the skin. Maybe for the fat destruction could be quite the same. I mean, if in one area there is 300 cc, we have to destroy 300 cc. It's not different, so we have not to do something different in this way. The thing is how we can have more result on the skin tightening in very tricky areas. For example, if we treat the flank or if we treat the inner knees, there's no problem even in 10, 15, 20 years, because in that area there's no, it's not so difficult or quite a little bit more difficult respect the abdomen, respect the inner thigh, respect the inner knees, where there is something that we have to do more, means the skin tightening. So this is important, especially in some areas when there is something that can be improved with the laser. And in the same study, the study lead author and the FDA says that the fat cell absorb the laser energies better than other energies. So this means that the laser liposuction is nowadays have to be considered the best way to obtain the fat destruction and the skin tightening, better than any radiofrequency, any ultrasound and the rest. So this is how we work in FDA way. Then we can use whatever we have, for sure. But this is a diode laser. Diode laser. The wavelength is 1470 nanometers. So this is nowadays the higher wavelength that can be connected to a diode laser to work in the laser liposuction and the skin tightening. Okay.
I was working the device I used had two waves.
Yes.
One for tightening and the other for the lipolysis.
Yeah, maybe Dr. Marangoni.
Your machine was a double wavelength in the far infrared, in the low far infrared, 924, 975. 924 was targeting specifically the lipids, while the 975 was dedicated for the water to the skin tightening.
Dillo su questo.
But they were, both of them, they were lower than this wavelength, as we're going to show you in the graph. We don't have the fat here. But regarding water, if you compare what's happening in 900 nanometers, where you were working, so between this peak and this one, it's quite different than what we are doing around 1470 nanometers. Okay? On the other side, you have a better absorption in hemoglobin, while you lose any interference with hemoglobin after the 1000 nanometers. Okay? So theoretically, the one was more coagulative, while this less. Working at 1470, there is another graphic. This one, perfect, that shows us the behavior of the wavelength targeting only water, the blue one, and fat, the yellow. You were exactly here, approximately here, so you were in a good intersection of water and fat, but because these curves are described by a logarithm, they are not linear, of course, you cannot compare it of what is happening here at 1470 nanometers. What is interesting and very important to know for who is going to use this laser is that you cannot work with the same setting if you want to achieve the best result in tightening or in fat removal, in fat destruction. Why? Because the absorption that you have for the water is 14 to 18 times higher on what you have for the fat. For this reason, if you use the same power, you can't think to use the same emission time. It means that the disruption of water is much more rapid than the disruption of fat. So if you want to target the water, the pulse duration will be very short. If you want to target the fat, you need a longer pulse. Okay? This is valid because the basic concept of Endolift is based in keeping very low power in order to avoid any kind of local anesthesia without modifying the cutaneous plan, specifically for who are interested in working in facial treatment. And for this reason, keeping very low the power and managing the time on emission, changing them, give you the best result when you want to separate the skin tightening from the lipolysis.
Thanks, Mr. Marangoni. So again, when we do the laser liposuction, like when we do the liposuction, there is the two-machine technique. Probably 90% of you do two-machine technique. And there is a comparison of wavelength dependence from laser-assisted lipolysis effect. This means that in this study, they compare different wavelength, the 1064, 1320, and 1000 around 70. So this is, they perform the laser liposuction in different tissues, and the 1000 around 500 shows that the highest ablation efficiency with minimal hit over the depth when compared with the other two wavelengths. So this means that when we use the higher wavelength, we can be more effective on the effect destruction, more selective, with less power, so with the less risk of thermal injuries for sure, because as you can see, the thermal diffusion of the skin surface is lower when the wavelength is higher.
This is under tumescence?
Yes, absolutely. So this means that the platform permits to obtain the higher lipolysis or liposuction as you wish. So lipolysis, you destroy the fat and leave the fat there. Liposuction, you remove the fat destroyed, again. A fat with less power, so the watt is very low respect to the lower wavelength. For example, if you use a 808 nanometer for the laser liposuction, you have to use maybe 3 times, 4 times more watt respect to this wavelength. So the risk of thermal injuries could be will be higher. And the effect, again, on the fat is less. So with this wavelength, you can have the best effect on fat with the less risk of thermal injuries. So with the total risk. So there are the specific cannula. The specific cannula start from 1.2 millimeters, so it's very thin cannula. The main thing is when we do the liposuction, we enter in the fat with the cannula. We destroy everything. We create an empty, for sure. Then the bandage, the garment and everything, and we hope that the massage or LED or everything tight the tissue. But it's not always easy to obtain, especially in areas like inner thigh or inner arms. We know for sure. That's why using the cannula with the optical fiber inserted, this is the fiber. So the fiber is very thin, you see, and the fiber, maybe if you use other laser, you cannot do with this with the fiber. So you can even knot the fiber. So the fiber is very useful, it's very safe. That's an important thing when you work with the fiber. So the fiber is inserted inside the cannula, exit from the tip. So the cannula with the fiber is inserted inside the fat. We press the pedal, and the energy emitted, okay, with this wavelength, which color shot? The yellow. So it's a selective destruction of the fat. This is the easiest thing that we can say. And regarding the vessel are not touched. So we reduce maximum that is possible the risk of any vessel injury, so the risk of thrombosis, embolia, or death. And regarding the column of the skin, that usually with the cannula are destroyed, so we create like a skin laxity for sure, we can create for sure, the energy emitted shrink the column instead to destroy the column. So it's a selective destruction of the fat with a shrinking and a tightening of the skin. That's why the FDA approved us to be the best way to approach the fat excess. It's clear, right? It is very good, but maybe you know about this. So we use for the laser liposuction the radial fiber. So as I show you later, there are two kinds of fiber. The fiber that use sorry, there is a mistake here. So we use for the Endolift we use the radial fiber. For the laser liposuction we use the bare fiber. That later I'll show you. So the indications are the same of the classical liposuction, not different, but we can correct even the classical liposuction deformity or waves that sometimes comes in, especially in the culotte de cheval or in some areas after the old technique. And the area is pre-tunneled, so we do the local anesthesia as we do with the normal liposuction. Then at the beginning there is a little bit of resistance, but the diode laser emissions progress. The area gets softer and the initial resistance decreases. So at the beginning we have to create a right plane in the middle hypoderma. This is the right plane where we work usually, superficial middle hypoderma. Then we can give the energy in both directions. So this is how we work. And for surely the power setting and joule delivery depend by the area and the quantity of subcutaneous fat. So I mean the protocols and the treatment and to be customized like every day we do with our patient. So this is a study with a lower wavelength within a 980 nanometer to see the total joule delivered for each area. In our experience, we know that we are near to publish our experience. I started in 2002 to work with the first laser, but mainly in 2005 and mainly in 2009 when the 1500 exit with the fiber. So it's more than 10 years that we use that I use laser liposuction with this kind of laser in all my patients. And I can tell you that the totally energy delivered is more than a half of the lower wavelength, but with less risk, with the higher effectiveness on the fats. And after treatment, yes, the compression bandage for sure, like in the classical liposuction, but it's a shorter time because we don't create the classical bruising or blue or big areas like in the normal liposuction. And usually I suggest to use also the LED or manual lymph drainage like usually you suggest to your patient. These are the quality of result that we can obtain, for sure. We can obtain also with the liposuction, but for example, for the inner tight, this is a good result that we can obtain. Again, a nice result. Again, for the small bump in the abdomen, we can make flat. Again, for the culotte de cheval, it can be more flat. And for the inner arms, the patient was so happy about the result for the inner arms because it was a very tightening effect for sure. Again, here that I can consider to have this kind of result, even if the arms we can see that are different position, but you can see the nice result with the laser liposuction, especially for the abdomen. Again here, especially for the abdomen. Again here for the pseudogynecomastia. This is one of my best friends. After 3 days, just 3 days after, you see there's no bruising, just a little bit here, lateral, you know, outside the bandage. Sometimes happens outside the bandage that there is like a small bruising, but is not so aggressive like the old liposuction. Starting with the experience of the laser liposuction, we said, and when there's no fat to be destroyed, we can do something to tighten the skin. That's why we start in 2009, mainly the new technique that is called Endolift. Endo means inside and lift is lifting for sure. It's not a lifting, okay, or something lifting a fat or everything. It's an endolift. So it's a tightening of the tissue. So the remodeling comes not because there is not because the tissue goes up. Okay, so it's not the vector that we use in facelift. There is a tightening effect, so the skin is shrinked. Okay, this is why there is the result. I started in 2007. This was my first time that I talk about the endolight lift. We use a different laser, different wavelength, but from 2009 we started to use the endolift technique. So endolift is this fiber, this thin fiber. Consider that one red cells is about 8 micron. One of our hair is about 100 microns. This fiber is 200 microns. So it's like 2 hair. It's very thin. It's very, very thin and very flexible and this. The fiber is easily inserted inside the skin, as you can see. There's no incision, no local anesthesia, no anesthesia, nothing. And then the effect is given by the delivery of the energy directly inside the skin. Inside the skin means in the superficial and middle hypoderma. So the technique involved a diode laser platform at 1470 nanometer, that is this one. You can be customized, different colors, you know how it works. And fibers is called FTF, so it's called fiber to fiber, that are single use and with a lower cost. But I prefer that Mr. Marangoni maybe can talk about the new laser.
This is the last generation, the 4th generation of this kind of platform of diode laser. It's a completely integrated machine, including preset protocols and settings for a lot of different indications, not only in plastic surgery, but in general surgery and in dermatology. I want to stress the fact that he has also a fully integrated fractional scanner. So for who are interested in skin treatment, I mean wrinkle, pigmentation, or let's say superficial anesthetism, there is also the possibility to plug a fractional delivery that is non-ablative. The absorption we already mentioned before is selective in targeting the water and the fat, and for this reason we have developed 2 different kinds of probes, 2 different kinds of fibers. These fibers can be available with a flat tip or a radial tip. Which is the difference? In this graph, you cannot see exactly which is the main focusing difference. This is firing forwarding, just straight, as the one you were using in the past. This one is firing 360 degrees radially. The benefit is theoretically and practically due to targeting the skin that is upper, in the meantime at the lower side. The 2 and the 300 micron that are specifically working for facial treatment do not require any kind of anesthesia, just a cryo machine like a cryojet solution. It's more than enough to reduce the pain, while the 400 and the 600 are more dedicated for the fat, so the lipolysis, more than the Endolift. And in this case, you can combine a little bit of local anesthesia.
You use tumescence?
No, just a drop of local anesthesia. This is the design where we explain how the fiber is made. There is a conical tip that has that advantage that makes the fiber similar to a needle. So we don't need any incision, any cannula, any needle to get the fiber into the dermis, but we use the fiber as it is. And this explains how the photons fall out. The movement of the photon is like a sinusoidal. It finished here, and it makes a complete tour at 360 degrees without carbonizing the tip of the fiber. This is the main difference compared with the old system, where there was always a small bit of carbonization that were increasing the temperature at the tip, and for this reason we were always doing local tumescent anesthesia, that here we don't do. So the secret of the machine is to working with a very selective wavelength, with a very thin fiber, with a lapped mirrored tip that you see here in the flat version or in the conical version, where we don't create the minimal thermal damage in terms of carbonization. So mirrored tip means, unfortunately, single use, because of course after the emission you create a damage in terms of opacization of the tip of the fiber that makes the temperature get up, increase. This is the emission in frontal, so the bare, that is more specific for lipolysis, so frontal emission, and this is the radial one that is more specific for tightening. Of course, you can use both of them according to the anatomy of the patient. We don't say that one is better than the other. They are different. You can combine them, or you can prefer one of them if you don't have the other one, of course. The second one is more modern than the first one. Of course, the conical tip helps a lot the insertion in the dermis.
So, I mean, as you can see, there's no incision, no anesthesia, but if in the entry point the patient is a little bit sensitive or something, you can have a local anesthesia in the entry point, just in the entry point. So just a drop of local anesthesia. I never use it, honestly, but why not? So it's nothing that can change the quality of the result. It's something that you can use for sure. The cooling system, as Mr. Marangoni says, or you can use the easy guide. Maybe you know the easy guide, you do like an injection with cannula or something else. So you can use the easy guide. This is a treatment for the upper knees. That is an area that usually we are not very comfortable to treat a very good result. So the fiber can be inserted inside. This is a 400 micron fiber. And then we remove the easy guide and the fiber is inside. Again here, the butterfly, the orange butterfly is inserted inside, the fiber inserted inside, removing the fiber remain inside. So even if you are not too able to work with the fiber, enter with the fiber, but I'll show you that every one of you later, I'm sure that you can do it. With the 200 and 300 is quite easy. With the 400 and 600, we need maybe a hole with a needle or something. Maybe the easy guide could be a good option also to have easy insertion of the fiber. Again, the fiber have to be moved at 0.5 to 1 centimeter for each second. This is the right. This is the educational video. So from here you can understand where the fiber in the 95% of the body can be inserted. So the areas of the face and the body can be treated: the under chin, the neck, the mid lower face, the area upper lip, the forehead, to lift the lateral part of the forehead. So the fiber is inserted and we do a fan movement under the skin. But under the skin, what does it mean? Exactly, we have to stay in the superficial or middle hypoderma. This is the right plane. So we can shrink the column that are like a fan that can be shrinked from the laser, but not passing through the skin like all the other devices. We work directly inside.
What is the temperature of the end of the tip?
Okay, the external temperature recorded by the thermometer is 40 degrees, like any radio frequency of the rest.
The working tissue, the tissue, which temperature?
Is according by the ratio between power and emission time, but is between 50 and 55 degrees.
This is the right temperature to the collagen and denaturation, the modeling for sure.
And
so this is
67 you can arrive.
Yes, it's all. That's it. Okay, so as you can see, never exceed the 40 degrees from outside, but inside is for sure higher.
You want it to be deeper fat, so you need to go
a little bit deeper and change the setting. Because when you want to shrink the skin, that is the Endolift effect, because Endolift is the tightening of the skin. So the target is the water, mainly the water, and you shrink the skin, tightening the septum. Okay?
What do you do first? You first treat the fat and after that the lift, Endolift?
Okay, depends by the patient. I mean, usually for small areas where I don't have to inject like a local anesthesia and everything, you can choose between starting with the laser lipolysis or Endolift. So there's no difference. In my experience, always I start with Endolift, because more virgin is the tissue, better is it, because I have to work in a very precise plane. So always start with Endolift, that's the best thing. When I do the laser liposuction, during the laser liposuction, I can do at the end also the final effect with the tissue scrapping, the tissue tightening. So you can even do at the end. But usually I prefer to do in Endolift first and immediately after the liposuction.
You
Yes.
are in completely different levels. If you are
Yes.
doing the lipo, you are deeper. And for the Endolift, you must be much superficial.
That's correct. The thing is that when I do the liposuction, I use the local anesthesia. I do injections, so I can alter the plane. So it's better to work in a precise way. So thanks for asking. And this is the survey that we did with the 10 world most experienced doctors. So we asked to all our doctors in the world how many procedures you have done in the last year, so more than 5,000 procedures. Over this more than 5,000 procedures, we asked many things to understand how is in the world, how is the result in different parts of the face. This is a survey just for the face. So the main characteristic of the ideal patient is the cutaneous laxity. That's important for sure. It's not muscle laxity, it's not muscle falling, it's not anything else. So the best is cutaneous laxity and fat in excess. So we have the same device, we have the same fiber. Why we cannot destroy also a little bit of fat when it's needed for sure. But Endolift is for skin tightening. Then the areas that have been treated with much satisfaction is the lower eyelids, the cheeks, the mandibular border, the under chin and the neck. So those are the areas that have much result for sure. And usually the preparation of the patient is absolutely, there is a disinfection of the skin, removing of makeup, and the patient have to be in this position. So after we'll see all the patient in this position because it's the best position. Sometimes we do local anesthesia, not local anesthesia, we do sometimes truncular anesthesia. So for example, for the areas of the upper lip that is quite painful for sure, we don't inject nothing, but we can do the nerve block. This is something that we can do just for this area. But in this area, you know, we have many other things. We can combine it with fractional laser. So I do first the Endolift and immediately after the fractional laser. Or you can use the Profilo, you can use the hyaluronic, you can use the biostimulation. So you can combine the different things to achieve the best result. But nothing that is in your office at the moment can enter inside directly. So from inside, remodel the skin. Which is the end point. So when I have to finish the procedure is when I see in many procedure you have to consider maybe the lines emitted, maybe the totally energy delivered, maybe the quantity of fat excess, maybe 1 fial or 2 fial. So you can have a number, okay? In Endolift, we understood in the last years that the main endpoint are two. The first is the changing in shape of the tissue. The second is the changing in consistency of the tissue. The third endpoint is the totally jowl delivered. But I'll tell you something, when you do the liposuction, what you say is, yes, probably will be around 300 cc for sure, but you see the change in the shape of the tissue. You feel the change in consistency of the tissue. So it's exactly the same. So you can have an idea of the totally jowl delivered. Maybe here I have to give 200 joules, okay? But it's not the main endpoint. So the endpoint is when I see the changing in the shape of the tissue. This is the endpoint. So exactly like the liposuctions. I'm happy to talk with you because this morning with dermatologists wasn't easy to understand this kind of things, but now I'm sure that you understand. The wavelength used for sure is the 1470 nanometers in 100% of cases, and respect lower wavelength, as we said before, as Mr. Marangoni said, or if you use lower wavelength, you can have problem, for example, with bear, because lower wavelength shot the red, shot the black, so have different targeting colors, okay? This wavelength shot just the yellow. So there's no problem against the black people, red people, bear, or everything. This is another important thing. So you can apply this wavelength in any colors of the skin without any increased risk. This is much. Huh?
No blondes. Blonde people.
Ah, no blonde. No, from China, you mean? Yeah, that's it. So the average parameter used is 2-3 watt with 25-50 T on, 50-90 T off, and pulsed. You are comfortable with T on, T off, or maybe T on is the time that we emit the energy. T off is the time that we stop to emit the energy. So usually you have to balance the T on and T off considering the sensibility of the patient, considering the thickness of the tissue, considering many things. So when you switch on the laser, we create a clinical manual after this survey where you can find all the information that you need for each area, the average parameter. Okay, then you can customize for each patient. The favorite fiber is the 200, 300, and 400 for the face and neck, and mainly the 200 and 300. I tell you that the 300 is quite easy to use. The 300 is a good fiber, enter perfectly, doesn't move too much, but it's a little bit more painful respect the 200 that is very easy to be used. So when you are a little bit more skilled, consider always to start with the 200 if it's possible, except maybe Arabic patient or some thickness too much. Okay, when the skin is too tall, so you can even use the 300 is fine. The 400 is almost never used in the face and the neck, but we ask to give which is the fiber that you use more, that is the 200, then the 300, rarely the 400 for the face and the neck. The 400 and the 600 used for the body. Okay. This is the total jowl delivery for each area. For example, you can see the under chin, okay, could be around 250, 250 to 500. It's a large is a larger range, but that's why we have to customize for each patient. So it's not the totally jaw delivery that is the most important thing, okay? Okay, there's the patient perceived by the patient. The pain perceived by the patient is around 2.9, so it's not a pleasure. If the patient wants a pleasure, maybe can do something else for sure, but is more or less when we enter with the fiber could be like a needle. That's it. So we pinch the skin like this, because if I have to enter with the fiber in a flat skin like this, okay, it's not easy to enter. If I push and I make strong the skin, I can enter easily inside. So later I'll show you how it's easy to enter inside. So it's not a painful procedure. Even in the next day, some patients for 2-3 days can feel something, you know, but it's not nothing that can compromise the everyday life or social life or any dinner or aperitivo or whatever. So it's quite easy to receive this protocol. Is a simple procedure and have to remain a simple procedure. This is a main things. So it's a 15 minutes time procedure, and after this the patient can go immediately to do everything, okay, except the lower eyelids. The lower eyelids is not an area that is easy, because sometimes, or maybe more than sometimes, there will be a little swelling, redness to achieve the best result. But for the other areas, yeah, sometimes even the under chin, rarely. But in the other areas, there's quite no problem. Please.
Have you any experience in aging hands?
Yes, for sure. We can work theoretically in any area of the body where there is a skin laxity that can be shrinked. So considering this even in the tip of the nose, but we don't do it for sure, but we try it for sure, why not? So the hands is one of the areas that we usually work. The survey was just to ask, was for the face and neck. So there's not, but when we did the last survey, most of the doctors say that the hands are one of the best areas that can be treated. There is just one entry point from here, as with the cannula, and we can go in different positions. So it's quite easy to work also in the hands. The suggested session yearly is 1, so usually we do 1 session every year. That's the medium. So sometimes maybe the patient needs after 6-8 months, sometimes the patient maybe needs after a year and a half. Who knows, it's life, and inshallah. But 1 year is the important things. So this is the middle, this is the correct average, so 1 session every year. And you have to check the patient after 90 days, so it's the correct time to see the collagen remodeling and the rest. If the patient is a bit nervous and comes after 1 month, like all the other procedure, like Botox, if it comes after 2 days, oh, I don't see result, just wait, we need a little bit more days. So about the Endolift is quite the same, so wait the right time. The right time is in 2-3 months, okay? So the right time to check the patient is after 3 months. That's the best thing. And again, after treatment, you have to do nothing, okay? Or if you want to sell something, maybe to your patient, you want to increase the revenues, maybe you have a beautician that works with you, I don't know how is it here, but you can sell LED, you can sell manual like a drainage, or maybe you can sell creams, everything, you know, but what is needed really is nothing. I mean, the patient not to do anything. But sometimes the patient want to exit for 20 minutes with like a patch, you know. There are some patch that can be bought easily in the market, maybe you have it in your office. So the patch can be applied for 20 minutes. So the patient can have like, I did something, I have a patch here, I exit outside, I do the picture, I do selfish, so that's it. But honestly, what we need is nothing, okay? We can combine Endolift with other treatments. Yeah, most of the doctors, they say, I have the fractional laser. In the same laser, I can sell to the same patient the fractional laser, so why I cannot have double revenues? So I can have the money for the Endolift, and immediately after, I do the fractional laser. So it's like to combine, like a sandwich technique. I work from inside with Endolift, from outside with a fractional non-ablative laser. In this way, I can remodel in the easiest way the skin, especially for the lower eyelids. Then we're talking also about how we have to approach the lower eyelids in the correct way, considering the anatomy for sure. 85.5% of patients are very satisfied or satisfied. I mean, there is a Likert scale between 0 to 5. So 85.5 were between 4 and 5. If we say also patient satisfied, that is 3 in the scale, we arrived around 92-93%. So most of the patients are really satisfied and the doctor are really satisfied. So there's no doctor that says, oh, I'm not happy about the treatment, not happy about the result. I know why, because it's easy, give you revenues, there's almost no risk for our patient, there's no downtime, so it's quite that something that we can use in our everyday life, everyday practice. So all this information comes in the clinical manual. So when you buy the laser, it's not that maybe, oh, I don't remember what the doctor said, I put all this information in the clinical manual. So when you buy, there is the clinical manual with the introduction, contraindication, warnings, possible complication, what you need with materials, the post-procedure, patient preparation, again, the suggested parameters for each area. But anyway, easy. So the device preparation, suggested parameter for each area, you see lower eyelids, cheeks, mandibular border, under chin, neck, so speed of retraction, operation mode, which fiber is suggested, the time on, time off, and power. So for each area, we suggest you to use, to start with this average parameter that you can use and customize, considering the thickness of the tissue, the patient, and the rest. So even which are the step of the procedure, where in different areas we have to introduce the fiber, and the post-operative, the post-treatment, the control checkup, and the combination with other treatments. So it's a complete manual to have always, to keep always with us. This is the kind of result that we can obtain with the Endolift. Here there is also a little bit of laser lipolysis, not laser liposuction, so I just destroy a little bit of fat. I tell you something, when the area is small, like the under chin, maybe the inner knees, so small areas, and the total amount is not more than 250 cc, so it's a small amount for any liposuction, we can even leave the fat destroyed there. I mean, maybe the patient needs a lymphodrainage, LED, a massage, and the rest, but you can even leave if you want to do the procedure in office without any anesthesia. So that's quite easy. This morning we did a patient that she had just a small bump here of fat. We did first the Endolift, and immediately after, with the same fiber, changing the setting, working a little bit deeper inside the fat, we did the laser lipolysis. So, and the patient is quite good. So she doesn't feel too much. I mean, that required any tumescent or local anesthesia or just a few drops. Anything. So we have to consider always the patient that we have under our hands. This is another immediately tightening effect. You see the redness of the area. It's not a miracle. It's not a 3 centimeter lift, for sure. It's not possible without surgery. No, you know. So, but we have to consider that even a millimeter for our patient could be a meter. That's the important thing. So it's not that a millimeter is always a millimeter. So even when we consider a light result or big result like this is a platysmatic band that's going down. I can tell you I say to the patient, just surgery can give you result. And she told me, no, I want to try something else because I don't want surgery. There are some patients that don't want surgery, even there is surgical indication. And she have a good result for this part. That I can't imagine. Again, here there is a small bump that can be remodeled, and the mandibular border here, the mass falling, the starting mass falling could be lifted a little bit, the skin over this mass falling. Here again, there is a bump that probably we need to start to consider surgery. With Endolift, you can have a nice effect. Here again, I did a live masterclass in Bucharest in March 2015, and a doctor from the crew says, if you give me result now, I buy the laser. So the ladies come down, and I do one side treated, so immediately she have the result. We wait that the doctor bought the laser, and then I treat the other side. So this is another kind of light result that we can obtain with the Endolift laser. Again, with the neck. With the neck, we have not many arms in our pockets, but we can consider Endolift one of the best that we can be synergized, always with a fractional non-ablative laser. This is another kind of result that we can obtain with Endolift. And here I put also picture from friends and doctor. I like to call friends because we are all friends for sure. And that send me the picture almost every day that send us the picture from all over the world. So you can treat also the décolleté, even the under chin and the neck. Even this is one of my patients that I treat the malar area. So one of the best indication is the festoons in malar area. So the Endolift treatment of this area probably is even, I cannot tell you even better than surgery, but easier for sure than any kind of surgery. As we said before, when we treat the upper lips, the area up to the upper lips, we can obtain nice result even considering the synergy with other technology. But here I usually do local anesthetic in nerve block for sure. This is an abdominal treatment in a patient that she wants just to do something. I want to improve my quality. I don't know what I can do today. Maybe I can do Endolift. Yes, for sure, you can. So you can also have a nice result or something in patient that doesn't need too much, for sure. This patient maybe needs a lot. Maybe just surgery can give result. After 1 year, it's still a nice result just with Endolift. So why we have not to consider this kind of result when there's no muscle bump, muscle falling, muscle opening, when there's no extra fat, too much extra fat. So just the Endolift procedure can give nice result even after still 1 year. And I can tell you that sometimes when I check the patient after 6 months and I do the picture and I check the patient after a year, sometimes the result is improved. So it's not that every year you have to do the procedure. Okay, so this is the average. This is another area that you can easily treat. So this is a 300 micron fiber. The fiber is inserted inside, and we can tight the inner tight. Even like after all the liposuction, or maybe after dimagrimento, when you lose the weight, so there is a little bit of skin falling, so you can improve.
Slimming.
Slimming. So you can have also an improvement of the result with Endolift. I always prefer, because in the clinic where I work, patients stay a week or 2 weeks. They stay and they have a diet, a correct diet, correct sport, activity. We have I have more than 40 beauticians working with me. So we have a lot of things that the people can do and stay a week or 2 weeks. They come with the white coat without nothing under and stay a week or 2 weeks like this. So they like to do all the procedure in the same time. And usually I prefer to do Endolift before that they lose the weight. So when they start to lose the weight, the tissue is more tight. So you can have more less skin falling when you lose the weight. But it's just an idea to how to approach also the slimming the patient that want to reduce the fat. Another hard area to be treated is the ankle, what you can obtain with the ankle. So there are some areas, for example, for the upper knees, the ankle, that Endolift is strong because there's nothing else to compare with Endolift. So when you want to tight a little bit the ankle, you can even consider Endolift as one of the best procedures that you can offer to your patient. As I told you, the synergy is not given, and the results are not given just by one procedure, but the synergy of procedure can give you the best effect. For example, this patient that I can't imagine that just with Endolift and laser liposuction I can obtain a good result. I never see him again, and I says, "Oh, please, how you stay?" And he send a picture and says, "Oh, I feel very good." I thought just the neck lift here can be a good result, but not. He says, I have a very good result, and I'm just happy. He lives in Russia, so I never see him again. But I'm sure that it's not a professional picture, okay? But sometimes we can show also a not professional picture when it's so evident the quality of results. Sorry for this, but sometimes happens. Okay, but when there is, for example, cellulite, extra fat, mild skin laxity, what we can do? For sure, we can do the laser liposuction to the col de cheval, banana fold, and the rest. But to treat the buttocks and to obtain after just 7 days this kind of procedure, so you see there's no swelling, almost no swelling, there's almost no bruising, so it's not, you know, when you remove the bandage, sometimes it's a worse than this, for sure. But look at the buttocks. So the buttocks are really improved. How? We treat in synergy with Endolift for buttocks. So I insert the fiber in 2 or 3 point, remodeling all the areas, and we have a little bit of extra fat destroyed by the laser. We can feel the depression of cellulite to have an improvement also for this kind of anesthetism. How? I want to say thank you to your country because they create this amazing study in 2015 when they, maybe you know this study, where 10 patients are, they received one side from liposuction, one side from laser liposuction. So 10 patients, is not easy to find 10 patients that agree this kind of procedure. And they analyze, and you, so your country, analyze the quality of the cells inside the bag, okay? So after the laser liposuction, there are small uniform sized cells of which 95.7% are alive. So it's very high percentage after laser liposuction. After liposuction, the 79.7% of cells are alive. So when you want to do the fat grafting, like the lipotransferencia, the lipo filling, okay, you can have a better quality in fat respect the classical liposuction. And there is something else. The variable here of 95.7% is 2.7%. So is around 95 cells will be for sure alive. Here the variable is 18.3. So this means that if you remove 18.3 by 79 could be around the 60% of alive. So this is important because when you want to feel a little bit something, you want to remove the fat that you want to do after the LASEmaR 1500, so after the laser liposuction, a little bit of lipofilling, you can have a better quality of fat even after laser liposuction. The lower eyelids endolift, that can be called also closed lower eyelid blepharoplastic, means that the fiber is inserted in the lower eyelids, even in the orbicular part or in the palpebral part, and from there you can shrink the tissue. Later I go a little bit deeper in this concept, considering the anatomy. That's important for sure. This is the quality of result that you can obtain combining the Endolift with a fractional non-ablative laser. This is after 1 month. This is another treatment that can be done. So the fiber is inserted in the lower eyelids. Again, this is the immediately after. You can see that there is a redness in the lower eyelids. There is a bruising for sure. Everything could be. This is the result after 2 hours, so there is a light improvement of the quality, but this is the result after 3 months. So this is not easy to be approached without surgery. Yeah, you can use the transconjunctival with the maybe transposition of the fat with the lower eye bags, but the result like this can be done easily in 10-15 minutes in our patients. So it's quite good to obtain this kind of result.
You are working under the skin or in the fat?
Yes, I'll tell you later. So I have a picture about this because this is a very good question. Thanks. Again, this is immediately after another patient. Again, 1 month later and 1 year later. So it's very improved.
But you used CO2 laser on the skin also?
No, never CO2. No, well, if you have no, fractional laser. Yeah, fractional laser. Fractional laser. Yes, it's like a sandwich, you know, when you eat a sandwich. I work from inside with the fiber, from outside with the fractional non-ablative laser. Then, if the patient needs a CO2 laser, that is an ablative laser, you can use it for sure in other areas. But usually, to have a softer and easy approach, it's better to synergize Endolift with fractional non-ablative laser. So the downtime is about 2 hours after the fractional non-ablative laser, and then the patient can do almost everything. This is another not easy patient. It's not just the lower eyelids here, as you can see, no? So this is after 2 weeks and a half. This is a very good improvement of the result for sure, that maybe you can't obtain even with the surgery, who knows. This is another of my patients where I work with the Endolift and a fractional non-ablative light scan. So immediately I synergize the treatment and you can have this quality of result. And I also reduce the red spot with another kind of laser. This is another good result that you can obtain. What about the complication? Now, talking about the complication, we're talking about the anatomy of the lower eyelids. Okay, so this is where I want to focalize my presentation. So you know the anatomy for lower eyelids. There are different kind of classification. This is the last one in 2017 from Dr. Cotofana. So there are just the dark circle, or maybe there is the tear through deformity just in the middle. Then the tear through counts a little bit in the middle part, and there is intraorbital fat herniation and dark circle combined. Then in the D1 there is the tear through deformity, intraorbital fat herniation and skin excess combined, and here is the maximum that is possible. So total tear through deformity, intraorbital fat herniation and skin excess combined. So when we do our work and we classify the different problems in the lower eyelids, we have to understand the anatomy. That for sure you know, I'm sure that, but sometimes we have to focalize to something. This is the orbicularis muscle, okay? In the palpebral, I mean, over the orbicularis retained ligament, so in this part, there's no fat under the muscle. The skin is completely attached to the muscle, okay? So there you cannot say, I work in the superficial hypoderma, I work under the skin and there, because there's not. So there is the tarsus. We are talking about the external part. So there is the orbicularis muscle and there is the septum. Under the septum, there is the orbital fat. Okay. So which is the right plane to work with the fiber? Is preseptal. So we have to work between the muscle and the septum. It's easy to stay in this line because when you insert the fiber, you are under the muscle. When you use the cannula or use the needle or maybe the lipostructure to remodel this area, you know when you pass the septum, because there is a residue. That's it. Okay, you have not to feel this sensation. So if you don't feel it, you are over the septum. That's quite easy to understand. So for us, fortunately. Again, the skin of the lower eyelids can be regarded as one of the thinnest in the human body, measuring in mean 0.82 to 0.21 millimeter. But it's not the thinner one. The thinner skin is especially here, is for the malar area. So this is the thinner skin in the body. And especially when we work in Asia, there you know that especially many Asian has a very higher cheek here, and the skin is very thin. So in that kind of patient, you have to be very worried to do any kind of procedure. But fortunately here there is the fat under the skin. So in this part, you can insert the fiber under the skin in the fat. Again, I want to stress the concept. When we work, we talk about this part. You see, we remove the skin and there is just the orbicularis. There is nothing else. Okay, so there's no fat under. If you go a little bit deeper, the fat appear in the lateral part. Sometimes there is the herniation of the fat in the lateral part and the rest. So here we can start to work in the hypoderma under the skin, but in this part, for sure, we can work there. So if you treat the lower eyelids, the festoons or the malar bags, we have to consider always the anatomy. Anyway, we do another work. now it's clear. I answered to your question, so I think that this one is a very effectiveness picture. There are some cutaneous risk and vascular risk for sure. In any procedure, there are some risk. Anyway, is mathematic and not surgery. So risk for cutaneous, there's nothing. I mean, almost nothing. So maybe when we enter with the fiber, there will be a little bit of redness. When we enter with the fiber, we can maybe do many points or 2-3 points, so will be a little bit of red area, but it's nothing for sure. So it's not a risk. It's a predictable, it's something that can be predictable. Again, for the risk, for the vascular risk, yeah, maybe there is the risk when you use the hyaluronic, but not when you use the laser. I mean, if you inject inside a vessel, or maybe you compress an arteria, maybe you can have risk, okay, or necrosis, or ischemia, or everything, but not with the laser. So the maximum that we can create is a bruising. Nothing. Talking about the nerve, yes, you are a plastic surgeon, so you know you have to be very skilled when you do the facelift. The same areas have to be very worried. So the dangerous areas have to be considered always when we do Endolift, for sure. When we're talking about nerve injuries, the International Association for Study of Pain say that that could be anesthesia, paresthesia, hypoesthesia, hyperesthesia, and dysesthesia. Sorry, it's in Italian. And usually after Endolift, the main problem that can come, very rarely, but can come, is the alteration of sensibility. So it's paresthesia or hyperesthesia. This is something that passes few weeks, few days, who knows, but if you say to your patient that maybe for some days, for a few weeks, they can have like a tenderness, a tickling, or maybe a reduction, a hypoesthesia, paresthesia of the area, the patient knows and accepts, because there's nothing external, there's nothing that you can see, for sure. Something different is when, so you have to be worried always in the same areas. Don't work too close to the foramen. Neuroplasia. Neuroplasia is something that can be also in the facelift for sure. So can be also when you give too much energies, or when you use local anesthesia near the branch. So in this case, you can have like a neuropraxia. In this is, as you know, maybe you have your therapy. My technique, my therapy about for this kind of problem that fortunately I never had in the past, but I'm ready to have it, because you know surgery is always under our shoulder. But this is a patient from one of my friends, and this is the correct therapy, and after 1 week the patient fixed all the problem. So could be, for sure. So you have to use an anti-inflammatory action, so a cortisone 25 milligrams for a week. Nervonic acid is 1 for every day. It's important for the myelin sheath of nerve cells, so for the recovery after any nerve injuries. And B12. B12 is important also because play a key role in myelin's production, so the things that is around the nerves. So with this kind of therapy, you are able to control your patient, because you say that in a week or 2 weeks probably everything passes, and you give your the correct therapy. And is a fiber, for sure. The fiber, like any implants or anything, can be broken, for sure. So when you open the fiber, do this. It's called a stress test. So do a knot on the fiber like this, okay? So, and maybe you can move like this, the knot, okay? Or take the fiber around your fingers. So in this way you can stress the fiber, and you can be sure that the fiber is well built, okay? Sometimes there is a breaking at the entrance here of the fiber, but not here. This means that if the fiber can be broken, the fiber can remain also inside the patient. In the worldwide experience, only 3 cases happened, okay? And one patient to me, I tell you, was just easy to fix it, because it's a small piece of fiber that remains inside the skin. Just do like this and exit. So it's quite easy to let exit the fiber. Another patient was another doctor that called me, and the fiber was in the lower eyelids, and I explained her by phone how to do it, to move like this, and the fiber exit again. The third patient, unfortunately, the fiber is still in the inner arms, but nothing's happened. If there are a small piece of fiber stay inside the inner arms. I mean, it's not visible by X-ray, ultrasound, or RMN, so it's not visible. The patient do everything, so the patient is asymptomatic and have a small piece of this with a capsule probably around that stay for the life there without creating any kind of problem. So this is the only problem recorded that we know. And you know, edema and erythema can happen, but if the edema after 2 hours later is this, and after 3 months the result is this, welcome to a little bit of edema or erythema. Okay, conclusion, yeah, get the laser. That's important things for sure. The laser give us best results. So Endolift has no major complication, is no incision or or light pain. It's a fast procedure after learning curve. There is an immediate recovery, no elastic band compression, anything after the procedure. Normally 1 session a year. There is an immediate and middle long-term effect that increases in the effect in 30-90 days. We continues up to 1 year, as I told you before, and the protocol and stability of the result depends on the biology of the subject treated, like always, okay, and the areas. Now a few words about something that you can do with the same laser. So as I told you, in the same laser you can attach the fractional non-ablative laser. So without telling you what is this, we are tired, we want to do for the practical part, but this is the endpoint. So for 1-2 hours there will be a redness after the treatment. It's a fractional non-ablative laser for sure. Is a light scan, create areas of microthermal zone that can remodel the skin, and the wavelength of 1470 nanometer is the right and the correct technique to achieve around 0.6 until 1 millimeter of that in the skin remodeling in the histological studies. Usually there are 3 or 4 sessions, 1 every month. This is the right timing and the right setting for the procedure, and this is some result that can be achieved in the improving quality of the skin and reducing the pigmentation even just with a fractional non-ablative laser connected to a diode laser. Again, there is another technique that is called the Intra-Regional Therapy. So some patient maybe comes for the granuloma, for any injecting technique, or maybe for wrong material used in the past. This is one of the patients that comes in a live workshop a few years ago. And honestly, the best wavelength for the granuloma is 808. Okay, so when a granuloma is medium or big, it's better to use a stronger laser. So the 808 is the best, so considered the best wavelength to treat the granuloma. Okay, but when the granuloma is small, it's very small. Okay, you can have a good result also just with this laser. So you can also sell this kind of treatment to your clients and to your patient. Why? Because the granuloma, is composed by the product that is stay inside. Around the product there are 2 layers that from the histological studies demonstrated that there are 2 layers around the granuloma. And between the 2 layers there is bacteria. Okay, so with the laser you can fight even the bacteria that you can't with the just syringe or with the surgery. That remain always the best procedure to approach the granuloma. But this is the faster. Anyway, you can also use like a surgical handpiece. So when you want to do like blepharoplasty with laser, or like remove skin excess, or maybe any skin lesion, or maybe something like this that is a lipoma of the hair.
Sebaceous cyst.
Sebaceous cyst, no lipoma, sebaceous cyst of the hair. So it's quite easy and no bleeding incision. Then just with a Kelly or something, you can come around and then exit. So it's quite easy also to approach this kind of things. Then axillary hyperhidrosis. You know, you can have your treatment in thoracoscopy. You can have the treatment with injection, botulinum toxin injection, or you can use the treatment with this laser. So we do local anesthesia. So after local anesthesia of the area, we set the parameters in the laser, and there is a small cannula. This is 2.0 millimeter with the tip exit from the fiber exit from the tip and destroy the gland. So it is quite easy also to approach the axillary hyperhidrosis. And this is the minor test at T0 and after 1 month. This is one of my patients. So you can have a good results also with the axillary hyperhidrosis. If you have any question, maybe now, or I'm clear? Oh, thanks so much. So now we have like a small break, and then we have the practical part. Thanks so much.